sometimes. So just to give a background, I have changed trifocal IOL from a patient, who was complaining that on a mobile screen, the pattern, the unlock pattern, the small dots, white dots, she sees blur in that, and it was troubling her so much that I had to eventually, go for an explant of the trifocal IOL. So we have to be open with all these options. We don't know which way things might turn. So just on that background. So there are various kind of multifocal. Now these days we further classify multifocals into bifocal, trifocal, extended depth of focus based on the optical principle. Firstly, either it would be based on refractive mode where it will have zonal multifocal with different annular lengths created different focal points, or it could be diffractive like majority of our multifocals, be technical multifocals, panoptics, and the most recent EDOF, which is the wavefront shaping. Sir has already covered it in his presentation. So it's a very unique kind of a principle in which they have worked on the central 2.2 mm, and it creates a delay in the overall wavefront, giving that elongation or extended depth of focus. So that's a new technology. Now, just a point on comparison between existing, trifocal IOLs. So both being based on diffractive designs. Those are Synergy and Panoptics. In our observation also, the halos and glares are much less when in case of Panoptics. It's primarily because of their diffractive technology. So they basically use an enlightened optical technology, which is resulting in lesser halos and glares, and almost 88% of the energy utilization. Now, one of the very important questions these days that we are dealing with is what is an ideal optimal intermediate distance. Intermediate has become a very important aspect of today's life, wherein people are working from home. Majority of people are either on laptop, desktop. It needs to be considered. Intermediate is something which has come in big way. I feel that we should also assess our patients clinically for their intermediate distance, even in our clinics, just like we do it for near. There are calibrated charts available for that, which are kept at 65 centimeter distance. So this is something I think which we should start incorporating in our practice also. So what would be the ideal intermediate distance? So for reading a tablet computer, it is around 40 to using a computer monitor 63. So ideal distance is anywhere between 60 to 65 intermediate distance. That is where majority of intermediate work happens. Now, traditional trifocal technology so basically uses the principle of sequential diffractive optics, and in majority of these trifocal, the intermediate is created at around 80 centimeters, so which is a little bit away from what ideally it should have been. Now, speaking of panoptics, because of the enlightened technology which we discussed earlier, it creates gives an intermediate around 60 centimeters, which is more close to what ideally intermediate should be. Sir has already covered about Vivity IOL, so this slide just shows the wavefront shaping. It's the central 2.2 mm of the optic, which basically delays the wavefront and creates this elongation, which gives the extended depth. One learning with the EDOF lenses after having implanted many EDOF lenses from on various platforms is I think we need to promise less when it comes to near, because initially in the first few weeks the near distance is much sharper, but we have realized that over a period of time, over 3 months odd, this tends to fall and patient tends to require a reading glass. So we just need to guard against that and not show too much of excitement about near, especially in the initial post-operative period. So what is the difference between a conventional EDOF and Vivity, which is the new EDOF? So basically, conventional EDOFs were giving lesser range of vision, as well as they were having more aberrations, more dysphotopsia. So that is because they were eventually based on a diffractive platform, Whereas because of the newer platform, because of the wavefront delay, those problems are less. But at the same time, even the range of vision is less. So as to say, what is a perfect IOL? I would say that it does not exist. And perfect IOL would give a full range of vision for all distances and would have maybe no or nil visual disturbances. So there is no perfect IOL as on date. This just shows stretching and shifting of wavefront, which creates a continuous extended focal range instead of multiple focal point. In case of monofocal, it is more for distance. In case of bifocal, it is for near as well as distance. In trifocal, we have distinct three. Intermediate might be at different distances based on what trifocal technology you are using. Conventional EDOFs, which again in this case Symphony, which is on a diffracted platform, and the latest EDOF Vivity. So it creates a continuous extended focal range. Now this is a study which is done by Alcon, and they have compared halo's propensity for different IOLs. It just goes to show that it is more or less similar to their Acrisoft platform, the halo propensity. Our experience in Panoptics, Vivity also we've implanted many Vivity IOLs, but till now it's in limited supply, and we are yet to analyze our results with Vivity. But with Panoptics, we've implanted many. So these are those in which we have done a bilateral implant. So there were 72 such subjects, 144 eyes, and our experience was that almost 70% patients were achieving 6/6 or better. Almost 90% patients were achieving 6/9 or better. When it comes to near, this was far better. Almost 98% patients at 1 month were achieving N6 or better. So with Panoptics, it was very encouraging when it comes to near, when it comes to intermediate, our results were very nice.